All right, so we're here with Vicky today. She came in to see Dr. Davis because she's having knee pain and low back. Vicky, tell me, how long have you had this pain?
About 15 years.
Wow, 15 years. Have you done anything to make it feel better or try to fix it?
Gone to physical therapy, chiropractors, orthopedic surgeon for my knees, get the gel shots.
Gotcha. And it was just temporary relief, nothing else helped yet.
Yeah.
All right, so we want to see what it's causing you the most pain. So let's have you stand up. Any pain there?
Not too bad right now.
Okay. Let me have you step forward a little bit, just a little bit. Yep. And then separate your legs a little bit. And then you're going to do a squat. So go as slow as you can.
That's it.
That's it?
Walking up, yep.
All right. Then come up. Any pain there when you went down?
Yes.
Where in the knees?
Mostly under.
Okay. Anywhere in your back or just in the knees?
Just sore.
Sore? Okay.
Yeah.
Let's have you go down the stairs. Nice and slow. If you have to hold on, hold on.
Yeah, I've been walking like this for years. I can only do one step at a time.
Yeah, you can't do both.
No.
The pain.
This hurts when it bends.
When it bends. Okay, let's have you go up. How was that?
Everything cracks and
It hurts?
yeah.
So right now, the pain that you, where is it from 1 to 10? Where do you think the pain is right now from all the movements you did?
Not too, probably about a 7.
7? And out of all the movements you did, which one was the worst?
The steps.
The steps?
Well, of course, squatting I can't do, so.
And I know you were saying you were having difficulties, going and doing grocery shopping.
Yes.
Any activities standing for a long time.
I have to use a cart.
You have to use a cart, so it's hard for you to walk as
Yep.
well. All right, so you ready to start feeling better?
Yes, I am.
All right, let's do it.
Okay, take a deep breath and up. 1, 2, keep going. 3, 4, pull, up.
6, 7, 8, relax.
That's good.
Holy crap.
That's good.
All right, Vicky, so you just finished with the treatment. How you feel?
Tired and sore,
Sure, yes.
but looser.
Looser, so you feel like you can walk a little better. That's awesome.
Yeah.
All right, let's have you stand up.
Have you stand up?
Any pain there?
No, it was better.
Oh,
That's
good.
For sure.
No back, anything on the knees or back?
No,
Great.
You feel like your knees can bend now?
I do.
You had problems walking down the steps before?
Yeah.
Can you hold on to the railing and walk down the steps now?
We're not going to squat first. Let's squat
Okay,
first.
so you wanna
Let's see you
squat
squat.
first?
Yeah, nice and
Yeah.
slow coming down. Okay, we're
It's
moving.
making all kind of noise.
That's
Okay, we're moving a little bit better. You went down a little bit better.
Yeah.
That's great. Yeah.
Well, before you could do it.
No.
Yeah, we barely got
I
any
want you to
movement.
hold on to the handle just to be safe because I'm not asking for records here. I want you to walk down the steps at your own pace. You take it easy.
My normal walk.
Well, just take it easy. Let me ask you a question. Is it easier to walk down the steps right now?
A little bit. Yeah, it doesn't hurt.
Doesn't hurt. How about walking up the steps?
I could do it like regular.
Yeah. Go ahead.
That's I haven't even able to do.
Wait. What was that? Wait. We need you to speak loud. Wait. When was the last time you were able to walk down the steps normally, as you said?
Oh, years.
So wait a second. So you're telling me that after a 40-minute treatment at our NSO, you're able to walk up the steps? What did you say? Normally? Normally.
Yeah.
Right.
Yeah.
Right. So you feel like a.
I can be a human being again. Yes.
So, because my question to you is why? Why did you want to do this?
So that I could live.
Yeah.
That's it.
You mean your quality of life?
Yes.
You mean what were you losing out on your quality?
Everything.
Everything. Give me one. Give me three
can't
things.
Walk.
Yeah.
Can't stand long. Can't go to the beach.
So wait. So that means you couldn't go to the beach and enjoy your life.
Right.
So you want to enjoy your life.
Absolutely.
Oh, what a concept. I
Yeah,
love that
right?
concept.
Yeah.
We enjoy helping people enjoy their life.
Yeah.
That's why you're here.
Yeah.
That's why we're trying to help you.
That's
And
good.
we understand that you want to get rid of your pain, but that's just the tip of the iceberg, the pain.
Right.
It's getting rid of the problem.
So
Right.
And it's solving the problem.
what do you think is the pain now after you said
Yeah.
a 7? What do you think is your pain now?
really, maybe a 1.
Wow, 1. That's awesome.